Hello everyone, I'm Gayatri. I'm a recently qualified GP, and these are the things that I did that helped me pass SCA in first attempt. First thing I did was go to the RCGP website and printed the blueprint, the SCA blueprint, and went through the list and made myself aware of the topics that can come up for the exam. I also made sure that I gave myself ample amount of time to prepare for the exam. You cannot take this exam lightly. You need to make sure that you prepare well. So I gave myself around 3 to 4 months to prepare quite well before attempting the exam. And you need to remember that if you do the exam and if you fail, it can really affect your confidence because it is a practical exam. So just make sure that you are prepared well before you give your first attempt. Ensure that you have a reliable study partner. I was quite lucky because I had 2 to 3 people from my own cohort who was giving the exam at the same time. So we made a group and we ensured that we practiced regularly. So to begin with, we were practicing over the weekend, and then we slowly increased the pace to once or twice or even thrice a week, and then 1 or 2 months before exam we did ensure that we were practicing every single. The main resource that we used to revise is the SCA examination website, which was really useful. It had n number of cases, and we were trying to go through the cases on a day-to-day basis. Normally we generated a mock exam on the website, and then we used to go through each cases within that mock exam. This sort of ensured that we were not stuck within one area of topic, and that we were covering a wide range within the curriculum. I was also subscribed to Geeky Medic websites as well, but I don't think I used it at all, if I'm being honest. Next thing that I did was I was regularly listening to medical podcasts, and this was from the RCGP website, GP Notebook, and there is also a primary education podcast that is run by 2 GPs up from north, and they had good topics relevant for the exam. So I found those podcasts really useful, especially to retain clinical information. The only course that I attended was the Beach Pain course, which is the Medlighten course that's run by Beach Pain. I did find her course really useful. I did not attend the RCGP prep course. I did attend their free webinar, but few of my friends did attend their course, and they did say that it was quite useful. One thing that I did that I found really helpful was I did few mock exams. Now this was basically a mock exam that I sort of organized myself. I got a few of my cousins and my husband to act out as patients, and I did do 12 cases at a stretch, just